Alrighty, so we are going to be doing Lab Pass Off 8. I just kind of wanted to show you around so you know what I'm dealing with. So here we have, this is my penis that I will be using. The catheter will go in on this end and out on that end, and I want to give a little heads up. I have really tried to perfect it so that the catheter goes in and out and you can see the balloon on the other side, but sometimes it just doesn't work because I'm dealing with a potato. So there's a chance, and I'm hoping you're okay with this, that I dip my catheter tip inside of this water, but I know that if I do that then it can go through. There's also a slight chance, and I'm hoping this doesn't happen, that I might need to use my hand to pull it out on the other side. Obviously, I would never break that sterile field, or whatever you may want to call it, in a real catheter, but because we're dealing with potatoes and coronavirus, I hope you're okay with that. I'm using this ironing board so that it can be above my waist, but my kitchen table is not above my waist, and normally you would want it to be above your waist because you don't want anything to go below your waist when you're working with sterile things, because that can automatically cause things to not be sterile anymore. Also, for my garbage can, I'm just going to use the top of my washing machine because I don't really want to throw these things away, but I will throw it away above my waist because that's how you throw away garbage when you're sterile. This was really hard to get back on, so I hope that's okay. Alright, now, hopefully you can see this. I was going to have my husband film, but both of our cars have stopped working and he is fixing that. So, here we go. Starting with opening procedures. Okay. Hi, my name's Callie. I'm going to be your student nurse today. Is it okay if I come in? Perfect. Before we get started, can I verify your name and your date of birth? Okay, I'm going to provide privacy. Looks like we've got everything here. Charlie, do you have any allergies that I should be aware of? Or any allergies at all? Nope, perfect. I'm just going to write my name up here on the board. I'm going to raise this bed up to proper working height and make sure that the wheels are locked. Charlie, you're about ready to go into surgery, and your doctor has asked that we give you a catheter for this. Do you have any questions of what this may entail? No? Well, okay, so basically what's going to happen is we're going to have a catheter tube, which you can see once I get it open, and the catheter tube will go right into the urethra of your penis, and it's going to go all the way through, and then I will blow up a balloon full of sterile water so that it can't come out. And I'm going to make this as painless as possible, but if it does hurt, please feel free to let me know. Before we get started, I do want to do a little pre-assessment. Have you noticed any changes in your urine recently? Oh, any color changes, smell changes, any blood in your urine? Have you noticed any urgency or frequency, anything like that? Nope, everything's been pretty normal? Okay, perfect. Well, before we get started with the catheter, I'm going to wash my hands and put some gloves on so that I can just take a look here. Okay, so I'm going to pull back the blanket, cover him as much as possible, and then I'm just going to take a look at his penis, make sure that everything looks normal and that I know where I'll be at. I'm also going to maybe clean it a little bit, tip to base, in case there's anything on there. Okay, everything looks perfect. Alright, well let's go ahead and get started. I'm going to take these gloves off and then throw them away. And then I'm going to wash my hands, making sure that I don't have any jewelry on, watches, things like that. Okay, so now we're here. I'm going to grab this, flip it around, grab this, go away from me, or outside, and middle. Making sure that I'm not touching the inside to keep it sterile. Perfect. Now I'm going to grab my gloves and I'm going to just put them over here on the bed. We're going to lay them out flat, making sure that I'm not touching the insides of this container. Okay, my left hand's going to go first. I'm only going to touch, I guess you can't really see that. I'm only going to touch the inside of this glove and working my hands up, making sure I'm not touching the outside. So this has been sterile. Now with this hand, I'm going to go on the inside, also in an upward motion, not touching the inside, everything's on the outside, and we're sterile there. I'm going to pinch the inside and drop this in the garbage above my waist. Now, I'm going to grab this chucks or pad or covering, whatever you're going to call it, and we're going to lay this below the patient. I will ask him to raise his bottom. We'll put it on underneath. Now I'm going to grab the male covering and so I should note that the bottom of that is now not sterile. And we're just gonna put that like so. Perfect. All right, now I'm going to place my containers on the bed, and everything looks to be in order. Now what I'm going to do is open everything up. I will open up my iodine. Well, I grab the tweezers, open up the iodine, squirt it on, and then keep the tweezers there for the time being. I'll throw this away above my waist. Then I will grab the lube, I'll open it up, squirt it in so that I can put the catheter tip there in just a bit. Once I'm done with that, I'll throw it away above my waist. Okay, now I need to check and I'm making sure to not go over the sterile field when I'm doing this. So now I'm going to check make sure that the balloon is working. So I'm gonna hold this here so that I can see it. And we're gonna put the syringe in here. I'm not working over my sterile field. And we're just gonna inject. It's not wanting to go in. Now we're just going to inject this to make sure the balloon is working. Perfect. The balloon looks great. We've got it all in. Now I'm gonna pull it all back out. Sometimes easier said than done. Perfect. All right, this is all still sterile, so I'm going to put it back where it was. Everything is still sterile. Now I'm going to take this covering off, being careful not to let the tip flick around. I'm going to hold it with a sturdy hand once I get it out. This will be thrown away above my waist. And I'm just going to set it in the lube. Like I said, a little easier said than done because I don't have lube for it to be set in, but that is how I would do it in my process. Okay, now I'm going to, I'm just opening this up just in case I need it for the potato. So I typically wouldn't break sterile field because my hands are sterile, so please forgive me. But I just want you to know that you wouldn't do that typically, but you also typically wouldn't use a potato. Okay, so now I'm going to make this hand contaminated by holding the penis upwards. I'm going to grab the cotton ball with the tweezers in this hand, and I'm going to start at the top, the tip in a circular motion, and it's only going to be one 360-degree wash for each cotton ball. So I'm going to throw this away above my waist, We'll do the next one, and as many as needed. Keep throwing those away. Perfect, everything looks clean. And now I will throw these away because they are sterile. They are contaminated. And that's above my waist. So, now what I'm going to do is I'm going to grab the catheter tip and I'm going to insert it into the okay, so first I would say take a big deep breath in and a big deep breath out, and I would insert it while it is going out, while he's breathing out. If we have any problems here and it's causing pain or not going in, I would invite him to take some good deep breaths, do what would relax him, and sorry, I wouldn't let that go. I'm just trying to see if this is going to come out on the other end. I normally would not do this on a real catheter because that is breaking everything sterile. So, I might have him breathe in and out, maybe wiggle his toes a little bit. One thing that, okay, this is not working, so I really practiced it so that it wouldn't do this. Oh, maybe. Wanting to make sure that this over here is staying sterile. Well, I guess that part's not really going in on them, but I'm just trying to see how far out it is. Okay, I practiced really hard to make sure that this wouldn't happen, but obviously it would. So I am just gonna dip this catheter tip in the water here. You would never do that, but you could put lube on it, but obviously that's breaking sterile filled, so you would need to get a new catheter probably. Okay, and you would put this, I forgot to mention that in my pre-assessment, I would make sure that the patient knows that this is all sterile and he shouldn't touch anything down here. Okay, this feels a little bit better. It's also hard with really big gloves on. There we go. Okay. Now I'm going to also do another big no-no, but I'm going to reach over and pull it out. Okay, so now you can see it on the other end. I'm sorry, I would never do that, but for this purpose. Okay, so I'm keeping my hand here. I feel like I was going to say something about important to this. Having him breathe in and out. Oh, I would push it in until I see urine come out, and then I would go in just a few more centimeters. Okay, so now, I'm trying to see if you can see this. I'm going to stick this on the green cap, and I'm going to fill up the balloon. Also, easier said than done. Okay, here we go. Ah! Okay, here we go. I would make sure that I am documenting how much I put into this so that when they take it out, they know how much should be taken out. Okay, that went great. I'm going to take this and throw it away below my waist. And now I'm just going to give a little tug, make sure that it's in there safe. Perfect. All right, I can now let go with this hand. All right, Charlie, everything went well. I'm just going to take my gloves off now and wash them. We're now going to clean up everything, and I'm going to tape this to your leg, okay? Perfect. So, this is all done now. Throwing it away. When I'm going to put this on my patient's leg, I will use some skin prep. I will rub it the skin prep. I will stick this on their legs, both sides, and then I will do this lower down, but I would clasp it like so that it can move. I would do this to their inner thigh. Some books say to do it to the abdomen, but that way that they can move around, but it won't get pulled out too much. Okay, Charlie, everything went well. I'm going to put this bag below your waist on a sturdy, like on the bed rail, something that won't move. Like on the bed frame, sorry, forgive me. And everything went well. Do you have any questions for me? Nope. Are you having any pain? No? Okay, good. I'm glad to hear it. Well, I will take this all and we will throw it away. And I'll be back in a little bit to check on you. And if you have any questions, please feel free to press your call light. Your water's right here. And I'll be back, okay? Perfect. I'm going to lower the bed so that you can be safe to the floor. And, yep, here's your call light. Feel free to call me if you need something, all right? Okay, open the door. Perfect. And now I would go document.